Hello, Bursties. I'm Emma Morris, registered dental hygienist, vice president of ambassador programs here at Burst, mom, and wife to a U.S. Air Force veteran. I'm so excited today to start a conversation with these two amazing ladies here. We have Samantha Conrad, who is a registered dental hygienist and Burst ambassador here at Burst. She also is a wife to an active duty Army. And then we also have Jessica here for Everyone for Veterans. And we're super excited to start the conversation about the veterans and what Burst and Everyone for Veterans can do together. Um, Jessica, can you tell us a little bit about what Everyone for Veterans is?
Yeah, we are a national nonprofit that serves veterans and their spouses, connecting them to dental care in their local communities. So, very few people realize that less than 15% of all veterans receive dental care from the VA. So, there's a gap there that exists for them. And our role is to help fill that gap by connecting them to local dentists, removing that travel barrier, and providing comprehensive care at no cost to the veterans that we serve.
Oh, wow. That's amazing and definitely needed for sure. So as far as dental care goes for active duty, Samantha, can you tell us kind of what is provided to you as a military spouse and to your husband for dental care?
Yes. So my husband just recently we PCS to New York from Texas, and as an active duty service member, he is able to get basically all the care he's needed on post. He just recently had a dental exam, his dental cleaning, and then he even had a consultation for ortho because he does have some gaps in his teeth. And now that he's not flying, he is able to have braces. So basically, as a service member, whatever you need, you are given.
For us, in my situation, it's a little different than Sam's just because we were not active duty. He was reserves, but then would be activated. We still kind of lived a civilian life and still saw our regular providers. But while he was active, it was just a different type of coverage. Jessica, with Everyone for Veterans, what are some education and access gaps slash barriers that Everyone for Veterans tries to mediate or to try to bridge that gap to help reach the needs of veterans?
Yeah, I think that there's a few things that we're really working towards. One of them is just that civilian understanding piece. When we reach out to dentists, we often hear things like, well, why would I, volunteer in this program because don't veterans get the care they need through the VA? So there is a lot of lack of understanding in the civilian population to know that veterans do have those struggles and barriers. There's a lot of access needs and availability needs. Many of our veterans live in rural communities without a dentist near them. So, especially this is prevalent in the American South where there are entire counties without a dentist. So, in those dental deserts, it may be 2 or more hours to get to a dentist. So, there's a lot of things that I think that many of us maybe take for granted because we haven't experienced those kinds of barriers and challenges. So, we spend a lot of time focusing on that as an organization to help bring awareness to this need, bring awareness to what civilians can do to step up and show our appreciation and support for the veterans in our communities. Not everyone can do everything for all people, but we just found this one area where we can support and give back. And so that's really been our focus.
Yeah, that's great. Because, like when I was practicing in private practice, I am in Georgia and we're not near a military base. So we had lots of questions, lots of people calling in. They might have worked at the university but were active duty. They didn't have access to care because there wasn't a local military base. And so for myself as a dental provider, it was hard for me to kind of navigate that.
One of the biggest problems I see with the active duty service members is they only get one cleaning a year. Essentially, there's not enough dentists and dental hygienists working on the bases. And I'm assuming that they just, as long as they see the dentist once a year and get once a year cleaning, that's good enough for them. Um, but being in private practice, we always push for them to be seen twice a year, even though that wasn't always an option.
I tried because I had that special place because I am a part of the military to try to provide access to care. So for situations like that, for providers, just for because we have other ambassadors here that may have questions like that. Is your company solely for the veterans, or like if there's questions that maybe healthcare providers may have, do y'all help to bridge that gap that way?
Our plan really is to serve as a liaison between the dentist and the veterans or veteran spouses. So when a veteran comes to us and there's no dental provider in their community, we begin outreach to dental providers who could step up as a partner to provide that care for them. And it works the other way. If a dentist comes to us from an area where they're looking to give back, we'll reach out to vet centers and VSOs to see if there's a veteran in need in that community for those services. So we provide a lot of training. We've done webinars, help how to support veterans experiencing challenges like PTSD, supporting their mental wellness journey through dental care as well. So we're happy to help answer questions from practitioners as well as the veteran community. We have a resource program that complements our dental program, and this helps kind of demystify those many challenges out there about what kind of additional resources are available, because our goal is that comprehensive care, and we know that oral health impacts the whole person. So sometimes things like job barriers, housing insecurity, all of those things are adding up and making it more difficult to get the dental care needs met. So our team wants to help answer any questions we can and connect people to the appropriate services and support that they need to live their very best life.
Oh, what an amazing organization to be able to bridge people together, especially those that have served or are serving our country. I love that. That's great.
Yeah. I had a few dentists that kind of acted as they bridged that gap. They helped work with the VA center and stuff, especially up in Washington. So that was kind of hit close to home. So, what are some unique dental issues or concerns that the veterans you work with have?
There are unique situations for every person. And so I think that that's really important too, to not just lump veterans as a group, thinking that because one thing is happening to one person, it's indicative of the full veteran experience. So this is another thing that we want to address with awareness, that some of our veterans may not have seen a dentist in 10 to 20 years. Some may have had care before they left service, and it's only been, a year and a half since they accessed that care. We see veterans of all eras, so there's no age prohibitors there. So our veterans are kind of all across the spectrum from World War II all the way up post 9/11. And every mouth is different. So we want to stress that to our dental volunteers also, that sometimes they may need continued support and reassurance because it's a really stressful and triggering experience. And maybe they want every procedure explained down to what this tool does, and I'm going to lower the chair, helping them be really engaged. And some people feel like all of that talking adds more stress, so they would like them not to explain what's going on. So we really encourage the dentists that are working with the veterans to just have that first initial meeting conversation with them. What do you prefer? How do you feel safe and comfortable? Is there anything I can do to make you feel like this is going to be a really positive experience? And start with open communication to make sure that their full dental experience is as successful as possible, because we understand that every person is going to be different and their dental concerns are going to be different.
For me, as a military wife, when veterans or when active duty or whoever would come in, that was a common ground. And it's like as soon as I would talk to them about that, I have military experience, my husband's military or whatever, it just found that common ground to make them feel a little bit more comfortable in the chair. So then it helped to calm things down and then walk them through, like you were saying, and talking to them about each individual procedure so that then they're prepared for what's to come. I really think that building that relationship and figuring out that connection with them really does help to make their experience a little bit better. What about, how do you feel about that, Sam?
I agree. And, as a reminder, we've seen so many patients as a provider. And just to make little reminders to myself for specific patients, like if they don't like loud noises, no music, or if they prefer watching TV or wearing headphones, having the lights on or off, I would always try and make little notes about that somewhere within the notes section so that I had that reminder to myself. So when I see them the next time, I have that all ready to go for them to make them comfortable.
Yeah.
And they appreciate that as well.
Yeah, for sure. So, Jessica, for volunteers at Everyone's for Veterans, Do you have volunteers that are ex-military, or what advice training do you give volunteers to prepare them to treat the veterans, or to treat the people that are associated with Everyone's for Veterans?
We do have a lot of our dental volunteers are prior veterans themselves, have the military experience, started out in their dental journey in the military, but not all. So some of them are, and they're drawn to that. I think veterans have a heart for service, and they always want to connect with their brothers and sisters. So it's wonderful when we can connect a veteran to a veteran. But I think there's also something really beautiful about the non veterans that see that need and want to stand up and say, I see you, I recognize you, I want to be there for you. So a lot of our dentists have no military connection. That's something that's becoming more and more common in our country across the board. You know, even a generation ago, just about every person had a personal connection to the military, whether their parent served or their sister served or something like that. And now the younger generations have entire families with no connection. So there is kind of that removal from an understanding of what the veteran experience is. So it's great when non veterans say, I want to help a veteran, I want to get involved, I want to give back. So we welcome absolutely everyone in the dental community to be a part of that journey for the veterans we're serving. And we do have training materials and links and resources available in their onboarding process to get them set up. And then, of course, our whole team is here to support them with any questions that come up along the way. Because sometimes it can be a little intimidating thinking about, serving a population that you just haven't worked with before. So we want to make sure that they're set up for success too.
Jessica, asking for help can be a vulnerable act. So, for veterans that may not have dental coverage, how would you encourage them to take the steps to reach out to Everyone's for Veterans?
So we try and make it as easy as possible by having a website application. They can do that from their own home anytime, day or night. So review the website, look at the qualification guidelines and see if you're a fit. And even if you're not a fit, we are happy to look at other resources that might be available in your area as well. So we would encourage you to reach out, talk to our team. We have the most wonderful, compassionate staff of program directors who handle those intake calls, speak with the veterans, speak with the spouses, answer any questions that they have. We're really here to support them. So we all have lived experience in one way or another with the military community, experiencing poverty, experiencing homelessness. We understand those struggles and barriers that many of our veterans are facing. And so we want to just embrace that with compassion and work with them. If there's reservations, if there's prior dental concerns that have them nervous, we want to help set them up the best we can at the beginning to make it as smooth as possible for them. So I would just encourage them, even if you're on the fence, if you've had struggles before with different kinds of applications, and that it's a very simple process, really straightforward, because we want to make sure that this is going to work well for them.
And so, just to clarify, for veterans, can it be active duty military that can reach out to you, or is it just people that are like veterans that have retired? It's anybody that can reach out.
So we serve veterans and their spouses, honorable discharge experience, and they have financial hardships and have completed one enlistment period. So those are our qualifiers. And then within that, there are always gray areas. So if there's an other than honorable discharge, that we can talk through that with them and see about those situations, making sure that it's safe for us and for them. We're happy to have those conversations as well to make sure that those people in need get the resources that they need.
So if they're a veteran and they need dental care, you're the one to reach out to.
Yeah, we would love to be able to help.
So, Jessica, it takes trust to build a network of like-minded healthcare professionals. Trust takes effort and time. What have you learned while working to gain that trust?
I think sharing the stories makes the biggest impact in that. Although we are a dental organization, I don't feel like we're about teeth. We're about self confidence. We're about pathways to employment. We're about keeping families happy and healthy and together. There's so many things that people overlook when it comes to oral health. If you're in chronic pain, if you have continuing infections, it impacts so much of your life, your ability to get a job or keep a job. All of these things have to do with that oral health. And so we really want to make sure that we're addressing that. and making sure that the people engaged in the program have that best chance at success. So I get excited when we get to share those stories. When I get to share with them the dad that really had never been told how important dental care was, and he had to have over $20,000 in dental care, and now he makes sure that every one of his kids has a toothbrush, and they brush twice a day, and they floss, and it's changing the oral health trajectory of his entire family because a dentist in his community invested in him and showed him what he needs to do to care for himself. So when we get to tell other dentists about stories like that, where you're not just changing one life, you're impacting an entire family and making a life transformation. I feel like it does build trust, and it gets people really excited about the opportunity to do something that they may have not thought that they could be a part of.
I love that. It's like genuinely caring for others and taking care of people and being able to help veterans that then changes the trajectory of what their generations to follow
Mhm.
will impact. And, you know, that as a hygienist myself was one of the main reasons why I went into the field was to help people.
We love our dental partners and the people who have kind of stood in that gap. And, unfortunately, we need so many more providers. Right now, we have people on our wait list from all over the country. We're currently active in 36 states, and more people are signing up every day because this is an overwhelming issue for the veterans we serve. So, anyone in the community that feels like they can give back and see, one veteran or spouse in their office a year is really all it takes to make that impact in their community. And we would love to have the conversation.
You're not a dental professional. What have you learned, or how has your routine changed since you've joined Everyone's for Veterans?
Yeah, that's a great question, and one that no one has ever asked me before. I definitely think about oral health a lot more. I was definitely that person that went once a year, had the cleaning, and went on my way. And now I think about it kind of constantly because there's always something else happening at the organization. And I think about it for myself and my husband and my son. And so it's definitely in the forefront of my mind now. And I think I notice teeth things more often. When I'm at the store, I notice the end cap of floss, and I notice the things that kind of jump out that were never in my world before.
Mm-hmm.
So yeah, there has definitely been a shift in my mind as towards oral health.
As a dental professional, we love that. We love whenever you
Yes.
start thinking about teeth all the time because you're now associated with teeth. That's the same way a lot of the people here on our team that are not dental professionals, all of us dental professionals that work here, we have rubbed off on them, and now all they talk about and think about is teeth. And I love it. Can you remind us again, where can we learn more about Everyone's for Veterans and how our community here at Burst can get involved?
So our website is everyoneforveterans.org. There's opportunities for dentists to sign up to be a part of the program, opportunities for community champions to financially support our work and get involved. We're always looking for civilian volunteers to help with everything from marketing, outreach, events, community involvement. So there really is something for everyone. And my contact is on there as well. So under the About Us section, if anyone wants to reach out to me directly to see how we can collaborate and do more together.
Here at Burst, we believe that oral care for everybody, and we have such an amazing community of dental professionals here that genuinely are like minded and are on a mission to change up the dental industry to help others and to change their dental and their overall well being. So, our mission here is to continue to connect with people like you and with other organizations that are giving back to people, because that is where we have founded our community of Burst Ambassadors, is to really try to connect with other people to provide oral care to everyone. So, thank you so much for your time. It was such a pleasure to learn more about your organization and what you are doing to change the dental industry and the trajectory for veterans and overall. And we wish you nothing but the best and are excited to see where our ambassador community can help.
Thank you so much. It was so great to spend some time with you today and help kind of get that word out about the need and the veteran experience. We appreciate it.
Yes, and Samantha, we appreciate you so much for being such an amazing Burst Ambassador and for all that you do
Thank you.
here in the Burst Ambassador community. We are so thankful for you joining us on the call today, and thank you for your service.
Yes, thank you for having me. I appreciate it.